It may seem a little strange in the midst of this ongoing healthcare discussion in America to bring up the subject of too much healthcare when we are concerned about the fact that so many of us don't have access to adequate services, can't afford them. Um, the notion that there is somehow out there the existence of too much healthcare may seem a little odd, but I believe there is such a thing. I'm in the business of providing health care. I cannot provide health. My patients are in the business of striving for health for themselves. I try to facilitate that, encourage that. I try to give them good advice and direction, treatments where needed. But in the end, I can't do that for them. Now, what I can do is I can provide so much health care that I actually hinder them in their pursuit of health. I've done it before. I regret it. I'll probably do it again, unintentionally. I see my colleagues do it all the time. If you talk with anybody engaged in health care, physician, nurse, technician, even hospital administrator, you'll find a broad agreement that the single most important factor in successfully achieving good health is the engagement of the patient in their own care. That's the best predictor of success. If a patient is engaged, personally invested, eager to participate in their own health care efforts, they stand the best chance of achieving health, maintaining health. It doesn't matter. We could be talking about a serious illness or about just health maintenance, taking good care of one's body. It's the same either way. I cannot require my patients to take on this attitude. I can encourage them to, but I can't require it. And we cannot, as a culture, purchase this attitude of engagement for our patients. Doesn't matter how much money we throw at it, we can't. But we can make it harder, and we do it a lot. Too much health care leads to poorer health. There is an attitude amongst patients that I've come to recognize, and I've given my own label. It's the "I'm broke, fix me" attitude. Anybody who's suffering with illness, struggling with pain, or even just the fear of getting worse or not getting better, is tempted to surrender the responsibility for their care and for their health to anybody around who's willing to take that on. Family members, friends, physicians, nurses. There's that temptation when somebody is suffering from illness. And of course we want to alleviate that suffering. We want to support them and comfort them and give them all that they need to heal, to get back to health, to achieve health. But it is possible to be so supportive, to be so available that we can actually encourage them to disengage from their care in the process. And that's a mistake. When we adopt as a culture a sentiment that we each have a right to health care, and we commit to that effort lots of resources, whether through public programs or through regulated insurance industry or through direct subsidies, we create in patients the greater tendency, all the greater tendency, to give in to that temptation to surrender their responsibility. We create that environment when we do that. Then the chance for good health for that patient is often lost, or at least severely hindered. And at the very same time, the costs of providing care for a patient in that situation go up, partly because utilization goes up. A patient who is disengaged from their care, overly dependent on the culture around them, on the system that's there for support, on their provider, will often be more demanding, will be be a higher user of medical care resources without any additional benefit. Medical care is the most effective and the most financially efficient when every patient is invested in his or her own care. And one of the most important ways we can encourage that is by setting up a situation where every medical decision that is made requires their involvement, requires them to be personally invested, financially and otherwise, time, effort, anything that they can contribute and should contribute. We need to require that, at least at some level, for every medical decision and every medical effort, if we're going to keep patients engaged in their care. We can provide public assistance, and yet we have to do it in such a way that we don't overbalance, that we do not intrude on their personal responsibility. Responsibility for their own health, for his or her own health, needs to rest with each individual patient. We need to leave it firmly in that territory, at the very same time as we provide support and encouragement and finances and services. This is the balance we have to strike. This is another important area where the sentimental right to health care interferes, gets in the way, causes us trouble, keeps us from solving this larger health care problem that we face. Thank you for listening. Thank you for thinking about this difficult subject. And thank you for speaking up with your own opinion.